One common condition that we see in our clinic is called severs. Severs is a very fancy term for heel pain in younger populations. Typically we see this in 8 to 16-year-olds, somewhere in there, especially if they are participating in a sport. Severs essentially means inflammation around the growth plate within the heel of the foot. So kids will typically complain of pain right here at the back of the heel, around where the Achilles tendon inserts on the calcaneus or the heel. And they'll describe it as something like a sharp pain when they jump or run, or just like a nagging dull ache that turns sharp when they try to run or jump. So typically the way we treat this is we evaluate everything from the low back all the way down to the toes. We see how the low back is moving, we see how the hips, the knee, the ankle, all of it, how it moves. Then we'll do a functional assessment. We'll see how they squat, how they run, things like that. We'll look for deficiencies in muscle activation and restrictions within the joints of the areas of the body that we discussed. Once we know everything is moving better and more efficiently, we'll get to some soft tissue work or some muscle work. Typically, if we trace along the calf muscles, we'll find a lot of trigger points or knots within the musculature of the back of the lower leg. So once we do muscle work on the calf and get everything loosened up and less tight, we will work our way down to the Achilles tendon. We're going to try to get some blood flow in this area. We're going to try to get it to relax a little bit. So if the muscles in the back of the lower leg are really tense and have a lot of trigger points in them, it can cause pain down to the foot. So what we'll do the joint work, we'll do the muscle work, and then we'll start to gradually load the Achilles tendon and reteach the body to load this tendon without aggravating the heel and where it inserts on the heel. So we'll try to decrease inflammation around the heel. We'll work on loading techniques of the tendon, get it stronger and able to handle running and jumping again. And then we'll teach our patients some stretches and some movements they should be doing before and after their participation in a sport. So if your child complains of heel pain, this is a very, very common thing we see. And it's something to not put off because it can be easily treated and fixed. If you guys need any help with something like this, feel free to reach out to our clinic and make an appointment.